This time of year is all about fun in the sun, but not protecting yourself from that sun could be the difference between life and death. We have Dr. Lee here with us now from Mosaic to talk about skin cancer and what you can do to prevent it from happening to you. So this is something really this time of year we're going to have people out lifeguarding all the time. People are going to be hitting the pools. What are the things that they really need to know before they head out in the sun?
Yeah, and this month is actually Skin Cancer Awareness Month, so it's the right month to start talking about this. The most important thing anytime you walk out the door is to put sunscreen on. And before you're out on the pool or you're going to spend a day out in the lake or something like that, you should put it on when you're at home because it's good to put it on about 30 minutes or 45 minutes before, especially if you're using a chemical sunblock, and because that takes some time to kind of absorb in the skin. About 30 or 45 minutes before you go to wherever it is that you're going. And then also you can wear a hat, wear protective clothing. There's actually clothing out there that has UPF rating as well. So those are the two most important things.
And when we talk about sunscreen, if you're going out to the pool or the lake, about how often are we needing to reapply, especially if we're getting in the water?
If you're getting in the water, it'll say so in the sunscreen package. Usually it's about 60 to 80 minutes or so, but I usually recommend as soon as you're out of the water and you wipe off the water, just put the sunscreen back on. Anytime you're getting in the water again, you come back in, even if it's only been 30 minutes, I would just put it back on just to be on the safe side. And if you're not in the water, sunscreens last about 2 hours, no more than 2 hours. I would say if you have a family history of melanoma or a family history or yourself have a history of skin cancer, then I would say 1.5 hours.
Okay, so you just kind of need to know your own family history a little bit there as well. For people that, it's kind of the time of the year, some people are going into the tanning beds. Are those worse for you?
Absolutely. Tanning beds are terrible. If it were up to me and essentially all dermatologists in the world, we would ban all tanning beds. Tanning beds are significantly increases your risk of not just any skin cancer, but melanoma, which we know is a very deadly skin cancer.
And what are some changes people need to be on the lookout for on their body? What are something that might be an abnormality?
So we always talk about the A, B, C, D, E of melanoma, and if you forget what I say, it's very easy to look this up. I always tell my patients, just look up A, B, C, D, E of melanoma. A is if you think of it as breaking the lesion in half, the spot in half, and if one half is different from the other, then it's asymmetry. B stands for borders, and it doesn't have to be a perfect border, but it doesn't have to be circular, but what you're looking for is the little jagged edges. So it's almost like you're looking for little nasty finger-like projections. C is for color changes, D is diameter getting bigger, E is evolving, just overall changing.
Okay, so the A, B, C, D, E.
Of melanoma.
Of melanoma. Those are the good tips to look out for.
Yes.
Thank you, Dr. Lee, for being here today.
You're welcome.